Okay, so there's three reasons why we're here talking about the 1023 campaign. The first is that homeopathy is scientifically implausible. So they believe that like cures like. So onions will help hay fever because onions make your eyes water, and the symptoms of hay fever are watery eyes. It's completely scientifically unproven. They believe that increases in the dilution of a substance will increase its potency, increase its effectiveness. Again, utterly ridiculous, and the extent to which the homeopaths dilute their medicines means that actually the remedies that you can find in the shops have no active ingredients left whatsoever. They get around this with Law 3, which is that water has memory, invoking all kinds of quantum theory and thermodynamics, which they mangle horribly in their interpretations. So it's scientifically implausible. It's also had no evidence of efficacy in medical trials, and while occasional studies have shown some level of performance above the level of placebo, these tend to be low quality trials, and when analysed as a whole, homeopathy very rarely shows any consistent effect. This is some manufacturers claim that there's been no call for clinical trials of homeopathy, but that's demonstrably untrue. We all want trials of clinical efficacy before these kinds of products are licensed and allowed onto the drugs market. Finally, there is a harm to homeopathy. People ask us, well, if it's highly dilute water or sugar pills, then what's the harm in letting people take these medicines? Well, the answer to this is that they detract from conventional treatments which actually have active ingredients and can help people. So concepts such as vaccinations using homeopathic remedies rather than using, for example, the MMR vaccine. Anti-malarials are given out by homeopaths which have absolutely no evidence for their efficacy, and people do contract malaria on a regular basis. It's a horrible disease which is highly communicable. And finally, there are cases where completely preventable diseases have a disproportionate impact on an individual, such as a case where a young girl died from complications due to eczema because her parents insisted on trying to use naturopathic products and homeopathic products in particular, rather than consulting conventional medicine. And that girl died a horrible death aged 9 months in Australia. So there is a real threat to human health. So we have scientific implausibility, no evidence for efficacy, and a real threat to human health. And that's why we're speaking out about it. That's why the 1023 campaign exists. And that's why we're here today.